Ultrasound is really an add-on to mammograms. Ultrasound looks at the breast tissue in a different way than a mammogram. Um, Ultrasounds are used as problem-solving tools, especially if somebody has a lump or pain or some abnormality on the mammogram. Ultrasound uses high-frequency sound waves, and it can look at the breast tissue. Ultrasound is particularly useful in women who have dense breast tissue, which makes the mammograms less useful in terms of seeing abnormalities. So we use ultrasound in breast symptoms like a mass or pain or lump, and in situations where the mammogram shows dense breast tissue. Ultrasound is very good at telling the difference between something that's solid, like a cancer or a fibroadenoma, and a cyst, which is just fluid in the breast. That's a particular significant value of ultrasound. Ultrasound can also be used for doing biopsies. If you see an abnormality on a mammogram only, then we'd be doing what we call a stereotactic needle biopsy. A stereotactic needle biopsy is done when the patient's lying down, face down, with the breast going through a hole in the stereotactic table. And that's obviously not a very comfortable procedure. If we can see that same abnormality on ultrasound, then we can do an ultrasound guided needle biopsy, which is done with the patient lying on her back. Often it's a lot more comfortable for the patient. So, we do stereotactic needle biopsies for lesions only seen on mammogram, and we do ultrasound guided core biopsies on lesions that we see on ultrasound. So it helps work out a problem, and it can be used for doing procedures.